Good afternoon and welcome to the Rotary Club of Madison. I'm George Hidalgo, Club President, and thank you for joining us. So let's open our meeting today by reciting the 4-way plus test. Of the things we think, say, or do. 1, is it the truth? Is it fair to all concerned? Will it build goodwill and better friendships? Will it be beneficial to all concerned? And as you know, this year we've added the 5th way, which is, will it be fun to all concerned? Obviously, as you know, we want to have fun this year. So thank you for joining us through the 4-way plus test. And I'd like to go ahead and announce the opening music, which will be My Country 'Tis of Thee, played by Lane Mishler. Lane? So thanks to Lane Mishler for playing today's patriotic song. So today's opening message is focusing again on what makes our club so unique. And quite often when you participate with various organizations, especially nonprofits, you end up doing things like, frozen pizza sales, raffle ticket sales, organizing a gala. Obviously, our organization is slightly different, that we're what they call a checkbook club, which for people like me, we kind of prefer that because we do participate with other charities that do those other things. So it's nice to get a little bit of a break, and we have several ways of where we raise funds. In fact, we actually have 4 priorities of giving, which are shown on the chart. So our first priority is our annual fund drive, which goes from November 1st to January 15th. Our second is our Rotary International Foundation fund drive, which is held each spring. And then we have contributions for your birthday, and couple that with it's usually rounded up to help support the Synergy Fund. So basically, each week, members celebrate birthdays are given an opportunity to contribute to our Madison Rotary Foundation. So the amount of your birthday years is deposited into our Foundation General Endowment Fund, right? So that means the gift goes into the fund, and we get 5% of the interest on your gift is used for annual grants program. So if you round up to $100, the additional amount then goes to the Synergy Scholarship Endowment Fund, with again 5% of the funds used each year to support our annual scholarship program. So while a vast majority of our annual scholarship funding is made possible by endowment fund donors, the Synergy Roundup opportunity allows all members an opportunity to support the scholarship program. So if you think about it, that support is enhancing the amount our foundation is providing to families and individuals in need in our community, and also helping students to obtain a college degree. So you should be proud of the support we can give to the community with your gifts to our Madison Rotary Foundation as you celebrate your birthday. And thank you for the fantastic support that benefits our community. So obviously, 4 ways of giving, right? 4 priorities of giving, and it's interesting when you look at it. So let's say Mike Casey, for example. Let's assume Mike Casey is 60 years old. So that would be $60 goes to the General Endowment, and he rounds up to 100. So $60 goes to the General Endowment Fund, and then the other $40 goes to the Synergy Scholarship Endowment Fund. So he's helping both categories in terms of general grants and also in terms of the scholarships, right? Now, someone like Sarah Bess, and I know Sarah got married, so I think she's probably 21, right? And she rounds up to 100. So Sarah being 21, that $21 goes to the General Endowment Fund, and then the additional amount, which is $79, will go to the Synergy Scholarship endowment fund. So again, depending on your age and what you contribute, it'll be broken down that way. So based on that and knowing our members, and I know that I joke about our average membership being 107 years old, but really in actuality, is about 63 years old. So you got to figure, I'm actually 62. So when I donate $100, 62 goes to the general endowment fund, and the other 38 goes into the Synergy Scholarship Endowment Fund. So question to everybody that's observing this presentation today, and the question is, for the 2019-2020 Rotary year, what did our fellow Rotarians contribute in birthday and Synergy Roundup gifts? Okay, so I want two separate answers, right? Now, knowing the age of our memberships, you can decide which one will be bigger than the others, and I know that unless you're in the finance side of the house or on the foundation, you may not know the exact numbers, but please engage your brain and see who can come the closest. And don't be shy. I mean, we're all pretty mature Rotarians with a lot of experience in our belt. And everyone on this chat should at least take a swag. Now, it was interesting. Swag is something I'm familiar with. If I look at both Jason and Brian here, being engineers, they know what swag is. But some of you may not know what swag is. So it is take a scientific, wild... That's for the A, guess. So please do a swag, and we'll go ahead and come back to answers for this question. So we'll go on to announcements and committee reports. So Greg Frank was our speaker last week, and I guess I'm told he's returning this week with an Ask George question. And so let's see what Greg has to say.
Well, Greg couldn't be here today, so I'm going to ask the question for him, George. Last week, you asked Greg a really tough question right at the end of Q&A. And so grab the earbuds there so you can hear the question, and I'm going to replay it, and then we'll go to the question.
Okay, and the final question, I'm not sure if everyone knows all the food fight restaurants. Can you state all of them, please?
Oh, geez, George. I'll try.
That was a stump question, yeah.
Cool. All right, you can take your earbuds off, George. So here, up on the screen, is the question. Can you name all the Honda models of Violentstown Honda?
Well, first of all, I didn't realize I was putting Greg on the spot, and here's the reasons why. I actually didn't know how large Food Fight restaurant group was. My guess was there were 5 or 6 restaurants, and I've gone to several of them. Obviously, the Avenue Bar and Bubble Up Club, and then Delmonico Steakhouse. I'll probably visit a couple of them, and I figured that was it. So I was really surprised when I asked that question. I really didn't know the answer, and when he started citing off 20, it blew me away. So actually, I was by asking that question, I kind of put him on the spot, and I would apologize for being a Richard on that one, especially to fellow Rotarian. So that wasn't very fair. And in answer to your questions, so we can go through cars first. So we have the Honda Fit, we have the Honda Civic, the Honda Insight, and obviously the Honda Accord. So that takes care of the cars. Then you get into trucks, and you have the HRV, then you get the CRV, then the next up is the Passport, then you have the Pilot, and then you have the pickup truck, which is the Ridgeline, and top of it all off, you have the Honda Odyssey. So altogether, we have 10, which is a lot less than your 22 dealership, 22 different restaurants. So I appreciate the question, but you actually gave me an easier one. So thank you very much, Greg. So we have birthdays to celebrate with a little bit of humor, or wisdom that complements Rotary's mission. So again, you heard the explanation as to what happens with the birthday gift and then the roundup to the Synergy Scholarship Fund. So let's go ahead and read off some names. And first celebrant is Mike Casey, August 2nd. Next is Mallory Hepner, August 4th. August 4th, Mike Swanson. August 5th, Heather Hopke. August 6th, Megan Ballard. And August 7th, Wayne Glowak. And August 8th, Sarah Best. So thanks to our celebrants for their contributions to the Madison Rotary Foundation. Please join me in wishing them a happy birthday.
Happy birthday to you. Happy birthday to you. Happy birthday, dear Rotarians. Happy birthday to you.
Bartel for leading us in singing happy birthday this week. Thank you, Jeff. So going back to our question, what was the closest answer? Do we have an answer or we need a little bit more time? Okay, so Charles McLymans gave an answer of, what was his answer? $20,000 in birthday gifts, and how much in the Synergy Energy Fund? Synergy Roundup gifts, excuse me. He didn't list that. Okay, so what we'll do is, in order to encourage participation, let's put on the 20-second timer and see what people can come up with in terms of the Synergy Roundup. Because remember, it's two different things, a birthday and a Synergy Roundup. So let's go. We got 20 seconds. So please use the chat function and give us an answer. Okay. Okay, so it looks like we have an answer from Mary O'Brien for $12,000. So what we have here is the Synergy Roundup gift is actually $7,000. So Mary, you're pretty close at that number. I mean, you're the one that came closest to it, obviously. So I encourage our Rotarians to participate. You can't be wrong, right? I mean, bottom line is you're going to be pretty close. So again, $20,000 in birthday gifts and $7,000 in Synergy Roundup gifts. So what we'll do is we'll provide to both Charles and Mary, we'll provide the following certificate. So it's a beautiful certificate, and we'll have the appropriate wording name in there, which will be framed and hung in a place of honor for all posterity. So they've also earned a glossy picture with Paul Harris, which can also be framed, and we'll do that once we get back to meeting in person. So thank you very much for participating in the chat function. We'll go on to announcements, and this is some announcements in the Connect, Grow, and Serve portion. So we'll talk about the Serve function. So our Rotary Community Projects invites Rotarians and their family members to volunteer on Thursday, August 13th from 12:30 to 4 p.m. to help our neighbors in need. Second Harvest Food Bank has created a care box packaging process and prepackaged food at Alliant Energy Center in response to COVID-19 emergency relief needs. Their process allows volunteers to follow safe social distancing while wearing masks. So join fellow Rotary and Rotaract members for this 3.5-hour shift and contact the Rotary office if you can help out. So next announcement is members in the news, and it will appear in the newsletter, but we'll highlight some of them now. And every week I try to highlight someone different, because it's amazing the impact that our Rotarians have in the community. So this week's member I'd like to feature from our members in the news is John Hayes. Many of you may have seen John featured among the business owners on State Street who were impacted by the riots in May. John has received tremendous support from the community as he worked to rebuild the jewelry cases and replace windows in the front door that were damaged. Now, John has been store manager of Goodman's Jewelers since 1983. He took over as owner in 1998 from the late Robert and Irwin Goodman, who are also Rotary members of our club. Now, Goodman Jewelers has been a fixture of State Street since 1933, and they have always been big supporters of our community. Each year, they have a tradition of generously covering admission for the first 500 swimmers on opening day of Madison's Goodman Pool. And did you know that each time our Rotary Club presents a Senior Service Award, the plaque that is presented to the recipient has been donated by Goodman's Jewelers? This is an award recognition that started in our club in 1975. John joined our Rotary Club in 1993. So in his 26 years of membership, you see him almost weekly at our Rotary luncheons when we meet in person, and he served on our club board of directors from 2014 to 2016. Now, John was featured on Talk Wisconsin on July 22nd and on NBC News on August 1st, and he shared the good news that Goodman Jewelers is reopening for business this week. So now I asked Pat if we could provide some support to John. I said, hey, can we encourage our members to kind of go buy jewelry at Goodman Jewelers? And she said, no, you can't do that. It's against club rules. So I can't do that. So what we can do is, now that his store is back open for business on State Street, stop by and say hello to John. Let him know that we've been thinking of him during these very, very challenging times. And John, for what you do to the community, thank you very much. Okay. Other members in the news this week, Paul Fanlin was quoted in an article about EVU Foundation's announcement of $350,000 awards to Black-led causes in Madison, and that's in the Capital Times 7/22 issue. Vicki Holsuch was quoted in an article about how Goodwill of South Central Wisconsin is adapting during the pandemic, and then that's Wisconsin State Journal 8/2. Jason Ilstrup, in an article about State Street businesses seeking a return to normalcy, his comment says 152 businesses, 152 different things happening. That was, again, the Wisconsin State Journal 8/2. And then Catherine Smith was quoted in an article about this year's Digital Opera in the Park held July 25th, and that's Capital Times 7/22. Again, congratulations to all our fellow Rotarians that are playing a leading role in the community. So thank you. Now on to our program. So our speaker today is Lisa Peyton-Caire, who is founding CEO and president of the Foundation for Black Women's Wellness, a Wisconsin-based organization launched in 2012 committed to eliminating health disparities and other barriers impacting Black women and their families and communities. She is married to Colleen Caire, who is a member of our Rotary Club. So the Foundation for Black Women's Wellness serves over 5,000 women and girls each year through direct health education, wellness programming, leadership development, and advocacy while mobilizing women and community partners to be change agents in advancing health equity. The title of Lisa's presentation today is Elevating Black Women's Health in Wisconsin, Why We Must, How We Can. We look for your presentation, Lisa, and we have made a contribution to the Rotary National Polio Plus Fund as a way to say thanks for speaking today. And please join me in welcoming Lisa Peyton-Caire to our podium. Lisa?
Oh my goodness. Good afternoon, everyone. It's so wonderful to be here again. My name is Lisa Peyton-Caire, founding CEO and president of the Foundation for Black Women's Wellness. And I really want to thank Rotary for the opportunity to speak with you this afternoon and to share about the work of the Foundation for Black Women's Wellness. Thank you, George, so much for introducing me. And of course, I need to thank one of your members, Oscar Morales, who is a dear friend of mine who is absolutely adamant in advocating for me to speak with Rotary, among several friends who I noticed in your live feed outside the door here are tuning in today. And I thank each and every one of you for your support in so many ways that so many of you already show throughout the year. Now, I must tell you that several months ago when I was first invited to speak here, I fully expected to be standing on the grand stage at the Park Hotel, looking out on that glorious Rotary crowd that I've sat in as a guest a few times before. And who would have thought, that just a few months later, we'd be here as I stand in a room being live streamed to you from the comfort of your home in the midst of a global pandemic. And for that reason and more, I'm all the more grateful that you are here and that I am here and that we're able to speak to each other today. So who is the Foundation for Black Women's Wellness? We are a small but mighty and growing nonprofit organization based here in Dane County. I established the organization in 2012 with a tremendous founding board of directors who between us have over 150 years of experience in health, community-based leadership, nonprofit leadership, and the like. And our purpose is very simple: to empower a generation of well Black women. And for those of you who may work downtown, you may have seen a legion of women walking in our community with the Well Black Women t-shirt that you can see on the screen, on the first screen that I just advanced. And that is what it means when you see those words. We are working to build and sustain a generation of healthy, well Black women. We are multi-generational in the focus of our work, touching the lives of women and girls across the lifespan, across the family system, because our intent is to transform Black women's health and their lives internally, and that grows externally to touch every single member of their immediate family, extended family, community, and that is how we achieve transformation. Our board of directors, as I said before, are a mighty group of women who've been in this work with me from the very beginning. You may recognize some of their faces. I'm very grateful for them. They're all each deeply involved and have been for years in multiple ways across our community when no one has been watching, to work and advance Black women's health and really health and well-being for our entire community. These women have stood by me for many years, and we've been blessed over the last 2 years to grow in our capacity from a one-woman show. When I say I founded this organization, I did in 2012 as a solo founder and leader for the first 7 years of our organization with a legion of volunteers, powerful, committed volunteer women who helped me carry out the work across our community. We've been fortunate this year to add 2.5 staff persons to our leadership team. Janine Stephens, who was formerly with the Boys and Girls Club of Dane County, Aaliyah Stevenson, who has an extensive health equity background, and Erin Bailey, also, who is a health equity leader based on UW campus, who works for us part-time. And it's really been because of the support of donors and sponsors, many who are watching today, that we've been able and continue to be able to grow our capacity. Our mission is quite powerful. We work to energize, mobilize, and support Black women to transform their lives through education, advocacy, leadership development, and powerful partnerships. We know that Black women are the most qualified to lead and shape the change that we need in our communities, in our families, in our world, and that they should be in positions and at tables to influence and shape decision-making and drive the solutions that we create, like we have and are doing here at the foundation. And that is fundamental and key to our work, but we know that we cannot do, and we do not do this work alone without the support of community and partners like you standing with us and behind us, beside us, to propel our work and our vision forward. A significant focus of our work is to eliminate health disparities and other barriers impacting the lives of Black women and girls and our families and our communities. And this is central because we exist in the reality right now, and this is sobering for many people to hear. And we don't say it with pleasure, but we say it as fact, that Wisconsin presently, and for quite some time, has led the nation in health, wealth, and quality of life disparities for Black women, children, and families. And this is persistent. If you can see some of the information on this graphic here, we know right now that in Wisconsin and across Dane County and many other areas in Wisconsin where you see larger populations of Black women, we are more likely to live and die from largely treatable and preventable illnesses, and we deal with that through education and ensuring that there is health care access. We're more likely to die of heart disease, cancer, stroke, breast cancer at younger ages at higher rates, to be diagnosed with more aggressive breast cancers that are harder to treat and to survive. And if you see the print in green on the slide, these are many of the partners or the solutions that we're enacting to address these disparities. Wisconsin currently leads the nation in birth disparities for Black women and babies, and we're doing significant work that I'll speak to later with the Dane County Health Council that we're very proud of and is making an impact. and the added layer of social and economic barriers that really contribute to and compound the poor health outcomes that we're seeing. And as you've read many reports, there have been many, about 20 reports published over the last decade documenting disparities. We know that the key things that drive health quality start beyond healthcare, with education, with income, with housing security, with many, many pieces that really impact family security, including Black women as a part of a family system. Because of this and many other reasons, we are seeing a life expectancy gap for Black women in Wisconsin that is widening and not narrowing. So we have our work cut out for us. But before I go any further in sharing more about our work, I have to tell you where and why this all began. On May 22nd, 2006, and this story is always difficult for me to tell, my mother, Roberta W. Peyton, died at the age of 64 from congestive heart failure. And this is she on the screen several years before she had her first heart attack at age 48. Second picture with she and I standing in her yard of the house that she purchased, that she worked hard to pass on to our children as a woman who was focused on building wealth for her family. And a third picture of me after she passed on, advocating in the ways that I can in her honor and in honor of all of our lives, so that other women might live. My mother was the anchor of our family and the reason why I'm standing here today as a woman with far more opportunities than she and her mother could ever have dreamed of. She was a soft-spoken but powerful woman who survived racism and discrimination in segregated pre-civil rights Richmond, Virginia, where she and I were born. And she would go on to graduate from her segregated high school, to pay her own way through cosmetology school, and to set up a thriving business called the Beauty Hut, her hairdresser that I spent every day of my life that I wasn't in home or church or at school. It was spent with my mother, learning her business, serving as her shampoo girl. And she ran that business for nearly 40 years until her health failed in her 40s. And before it failed, she managed to send me to college. Even after being a divorcee, she sent me to college and set our entire family system on a path to stability and prosperity that persists today. The unfortunate thing after my mother's death was my realization that her death was not the exception, but it was the norm for Black women. It was the norm for Black women. And as you see this picture that I have here on the screen, my mother in the center, flanked by women, real women, in my own family and extended community who have all succumbed early in life from death to heart disease, cancer, stroke, breast cancer, all types of cancers. These are my paternal aunts, my husband's mother, my husband's aunts, my aunts, and it's unacceptable. So the work is beyond theory, it's beyond statistics, it's real. And we have, unfortunately, the evidence of so many lives among myself and the many women who surround me in this work. We've got stories that we share in losing our mothers. In fact, there's many of us who have referred to ourselves as motherless children because so many of our mothers are passed on. And the unique feature about this is these women did not reach old age. My mother was 64. My aunts were 52, 62, and 67. My husband's mother was 63. She died a year before my mother. The youngest among these women were 52 years old. And I began to write those names down after my mother passed away. After her wake and her funeral, I sat in her house as we figured out what to do with her home, and I began to list the names of all of the women whose funerals I attended, or all the women whose hair I had shampooed in my mom's salon, who had passed away, either whose funeral I attended or whose phone call from a family member I took as I stood at the shampoo bowl in the back of my mom's shop as the customers called to say, "Lisa, I need you to sit down and pass this message on to your mom when she's not busy." And one after one after one, we would get the news of women, 48, 52, 58, maybe 60, who we had just seen the week prior, who had passed away over the weekend from a chronic illness. So it opened my eyes to that unacceptable reality of Black women dying in the prime of our lives and carrying really a lifetime of stress, on their backs to really lift their families and their communities in a world that too often ignored their existence or devalued their needs. And so that pushed me in 2009, 3 years after my mother's death, to create Black Women's Wellness Day, which was simply an event, the first idea of how do we convene a conversation among the most impacted women to begin to grapple with and talk about how we change this narrative, how we move forward in securing our lives and saving our lives and putting out a rallying cry where there was really dead silence in our communities and nationally, save for, one or two organizations that have been advocating for many years, but a state of emergency had not been declared for Black women's lives as we saw them one by one leaving this planet prematurely in the prime of their life. So this picture doesn't do the founding of Black Women's Wellness Day any justice because this is several years in here in Madison. But I started this work in Maryland where I was living at the time of my mother's death with 40 women, 40 like-minded women in a public library. I probably paid $60 to use the room. And I financed and started this work on my own. And from those 40 women who gathered that day and made a commitment to do all we can in the ways we can to save Black women's lives and to advocate for the things that we need to thrive in our homes and in our communities. From that, Black Women's Wellness Day has grown, and last year, this is a photo where we engaged 700 women here and community partners at the Alliant Energy Center and are celebrating our 12th anniversary this year, September 18th and 19th, where we will be taking our event virtual for the very first time. It's a daunting task, but we're doing it in the midst of COVID-19 to carry on our mission. That work in starting Black Women's Wellness Day was the starting point for the Foundation for Black Women's Wellness. We realized that day, over the years, that the incredible need in Dane County and Wisconsin as leader in the nation, as top in the nation for racial health disparities, that we absolutely had to grow our work beyond a one-day event. And that's when we established the Foundation for Black Women's Wellness as a vehicle to drive change, to move a bigger mission and a bigger vision forward, to build a world, starting with this community, where Black women and girls live, first of all, live healthy, well, and free with access to the tools and the opportunities they need to thrive. And we are 8 years into the work of the Foundation for Black Women's Wellness as an established 501c3 nonprofit, making major inroads, not only in illuminating the issue of Black women's health, but building public and community commitment and accountability for changing the unacceptable outcomes that we currently see. A significant part of that is really focusing on moving Wisconsin from worst to best for Black women's health and from last to first as a health equity leader. And we believe that we can do that because we have everything we need. When I look at this photo, I get excited about the possibilities and the potential for Wisconsin, who I must tell you, we tirelessly read the reports. And I do a great deal of speaking throughout the year all over Wisconsin. I was in Green Bay last year making this speech to a room full of medical doctors and health equity leaders from across the state, that we have such pride in our state. We have such innovation in our state. We have a tradition of trailblazing pioneers in our state that's core to who we are. Absolutely, we have everything we need to turn the tide on Black women's health and to move from worst to best. And we're committed to ensuring that we do our part to do that. We've got smart people. We've got world-class health systems. We've got world-class Research One University right here in our front yard in a 23 campus system across our state with scholars and research and young people who are becoming the next generation of leaders. We have an activist community and a very committed philanthropic community. Now what we need is the collective will and commitment and deeper accountability to say Black women's health is a priority to everyone in Dane County, to everyone in Wisconsin. And here's more evidence as to why. Presently, I wanted to come in here and just give the beautiful stories of how we transform women's lives and all the great work that we're doing, but I couldn't do that without truthfully stating all of the facts so that we have a level set understanding of where we are. Right now, Black women and our families and our communities in Wisconsin, statistically, as a whole group, are in crisis. And because of that, Wisconsin is in crisis because we cannot separate the lot of one from the whole. Right now, Wisconsin is number 1 in the nation, and you can seek reports. This is validated from research. I usually have those notations in my presentations, and I'm happy to send those on to those after this presentation. But right now, we rest in the unfortunate position amongst all the wonderful and great things that make Wisconsin a wonderful state. We've got an equity problem. We are top in the nation for racial inequality, which spans across many different areas: economic inequality, health disparities, birth disparities, education disparities. The achievement gap is well documented. That's been a topic of conversation for the entire 25 plus years that I've been tied and connected to Wisconsin. Black child poverty, over-incarceration, and the list could continue. And if you step back for a minute, it's not just Wisconsin. It's a Midwestern problem. In fact, it's a national problem, but the Midwest is unique in that 5 states with the highest levels of racial inequality are clustered together here in the Midwest, with Wisconsin leading as number 1, not only in the Midwest, but in the nation for racial inequality. And in fact, one report last year stated that Wisconsin was the worst place in America to raise a Black child. As a proud resident of Wisconsin who has lived half of my adult life here, who birthed 4 of my 5 children here, who's a proud alumnus of the UW-Madison twice, and who's working in this community, I'm not satisfied or content with this ranking for Wisconsin. And I believe it is our responsibility to change it. What that looks like on a personal level for Black women, right here in our own backyard. The average age of death for Black women in Dane County is 60 years old. That, coupled with the statistic that in the state of Wisconsin, we are the only state among 50 where the life expectancy gap between Black women and white women is stagnant or growing wider rather than closing. So Black women aren't living longer. We aren't keeping pace with life expectancy. And here in our county, this average age of death, which is calculated by how many Black women from birth or elder age die in a given year, that average age is 60, which is pretty young, and it is impacted in part by our significant birth disparities, where we lose Black babies at a 2 to 3 times greater rate than white babies in our county, skewing these numbers lower than we would want them to be. Again, to recap, in our state, Black women are facing higher rates of illness and death, despite having some of the most world-renowned healthcare, quality healthcare. We have tremendously superb healthcare systems here in our community, and many of them, most of them, are supporters of our work, yet we continue to see disparate outcomes in healthcare access, healthcare quality, and bias within our healthcare system that plays a role. We talked about the life expectancy gap, that we're number 1 in the nation for Black infant mortality. That's an area of work that our organization is deeply involved in with our 4 local health systems, with the United Way, Access Community Health Centers, Public Health Madison, Dane County, and our public school district to change. And I'll talk about that work later, and we rank number one for Black-white wealth gap, which I know with this group is of a deep concern. And that we're already feeling the levers in our minds spinning about how we can change this. This has all been exacerbated by COVID-19, where we unfortunately see our state, like many states across our country, struggling with our response. Much of that is due in part to a slow federal response, but nonetheless, we were recently cited as one of the worst in the nation for coronavirus community spread, third in the nation for coronavirus racial disparities, as played out in Milwaukee, where we see incredible differences in death rates, infection rates, hospitalization rates. And I know that our state leadership is working to address that, but we need to pick up the pace. And we're seeing the byproduct of how coronavirus has affected our entire community. Everyone in our community is reeling from the economic impacts, the housing impacts. We have been intimately involved in COVID-19 relief, and thanks to the generosity of several organizations, among them a Fund for Women and UW Credit Union, a recent donation from the FU Foundation, we've been able to specifically engage and support women to keep them housing secure, income secure, food secure in this interim as we work to figure out solutions to get our economy and our workers back on track. But in this, seeing these outcomes, they mirror what was existing prior to COVID-19 as racial disparities that play out in our neighborhoods, in the social and community context, education, economics, and health care. And we are really pushing people to see the whole picture. Oftentimes, as we talk about the Foundation for Black Women's Wellness and the health outcomes, folks say, well, that's a healthcare problem. That's a healthcare industry issue. The hospital systems, the clinics need to solve that. That is inaccurate. It's incorrect thinking, because we know the pieces that drive health quality really are rooted in many other factors around economic security and how that looks in terms of family stability. And in that context, where Black women are and families are faring in our community right now, that is where we have to drill down. I'm going to bypass some of the data because I've talked about it in the context of the discussion, but it's very important that we understand how the lives of the 15,000 Black women and girls in Dane County are currently playing out in our community, to understand why these health outcomes are in place. And I know I've got a time limit, so if anyone waves to me and let me know how I'm doing on time. We know that 8 in 10 Black women work in Dane County. And contrary often to public belief, and I worked in Madison several years ago in my first stint of living in Dane County after marrying and moved here. I worked throughout the social services, community-based nonprofit sector, and there's often a perception that Black women aren't working, that they're heavy on the welfare rolls, and that they're not a part of our local workforce and our economy, which is the opposite is true. 8 out of 10 women in Dane County, Black women, work, and that's a higher rate of workplace of employment than other groups of Black women. The problem is we are earning less. We are taking home less money, and we are over disproportionately raising family systems with children and adults with not enough money to support. And with 60% of Black households in Dane County led by single Black women, most of them working, we've got gaps to fill. Luckily, we do see an uptick in Black women entering higher education, but not enough. We have 2 in 10 Black women in Dane County with a bachelor's degree or higher, and we all know that higher education and specialized training really pushes folks into the middle class and in a more firm financial position, and that is absolutely vital for improving health quality and health outcomes for Black women when we build economic security. I'm going to move through some of the health statistics and focus a bit on Black babies. This is one of the most alarming pieces of the work, not the only, but one of the most, where we see first in the nation rates Black infant mortality here in Dane County, where a Black baby is 2 to 3 times more likely to be born low birth weight and to die in his or her first year of life. And one of the most compelling statistics that really show the unique factors of Black women's health is that studies have shown consistently that Black women with a college degree are still more likely to give birth prematurely or to a low birth weight baby who does not survive the first year of life than our white counterparts who have not yet completed a high school diploma. And what more and more research is telling us is that stress and something called allostatic load is the cause, because despite income, education, or zip code, it doesn't seem to matter. We can have a six-figure income and still experience worse health outcomes, even if we're eating the best food, going to the doctor for every appointment, getting timely care in an unbiased environment. We are still landing in the same position despite our income or status with our outcomes, and never is this more evident than in the health of babies in Wisconsin. And this is a state of emergency, really. Now we're working to change this. And it's so fun when I get to talk about the ways we're working to change this, because I understand that what I shared today, that data, those realities are very heavy, and they can tend to make us feel perplexed and confused as we think about our community, which is so often ranked as top in the nation for best place to live. And it is, but it's also top ranked as worst place to thrive for many families, which it is. And we need to reconcile those two disparate realities to build one city and one reality where everyone is thriving. And that is the charge of our work. And we work year-round, 365 days a year, to advance Black women's health. First, through health promotion, education, advocacy. Right now, we are fortunate to reach and touch about 5,000 women and girls each year. And again, I said there are 15,000 women, Black women in Dane County. We're happy to be reaching a third of them, but we need to reach more. Coronavirus has had the unexpected impact of forcing us into the virtual world. And so last year, that number was a little smaller. This year, right now, is growing, and next year is going to be double that number in terms of reach. But again, this is direct service reach. These are 5,000 women who we directly touch, who have shown up to an event, who have been a part of a learning and education, a fitness class, or leadership development session, of nutrition class, an advocacy class around advocating for yourself within healthcare environments, 5,000 women directly each year. These are just examples of the many sessions that we host throughout the year to equip and educate Black women first as their first best advocates to protect and preserve their lives, with preventative education around heart disease, cancer, stroke, diabetes, the importance of fitness, the importance of mental health, the importance of knowing how to sign up for health care if access is an issue. And we spend hours on the phone and working with partners to connect women to health care benefits. One of those partners is Covering Wisconsin, among others, and that's an important piece of our direct service work. We train legions of women as wellness ambassadors who really convey our mission and our message across the community, and we continue to grow. I often tell folks we're not a program. Folks will ask, well, what is your program? We're a movement. We're really a movement that is working to change the trajectory of Black women's health and to build public commitment and to energize and mobilize and equip Black women to be change agents, not only in their personal life, to improve their personal health, but to improve the health of others around them, and then to drive a health equity agenda that transforms how Black women's health looks across our state. And you may have seen our women walking at our state's capital. We're so lucky to live in Madison, in the seat of our capital, where we have access to our state leadership, where we can go to the Capitol as we have and talk with our governor and our lieutenant governor about Black women's health, and to push for public commitment as we wear our Well Black Women t-shirts together, as we build financial capacity among women, as we promote an advocacy and policy and systems change agenda by engaging our leaders who are decision makers and shaping policy that impacts Black women and families, and through powerful partnerships. And I wish I didn't just get this 5-minute alarm from George and team. So I'm going to race through this really quickly. Partnerships are so crucial. As I mentioned earlier, we are facing first in the nation mortality rates for Black babies and a rising rate of maternal mortality, deaths of mothers in childbirth in our state. And there's a powerful body of work that we're doing right now in bringing Black women and systems together with our Dane County Health Council to map out a plan which the Health Council funded, engaged our agency to inform their strategic process for how they will work collaboratively together over the next several years to turn the tide on our birth outcomes in our county. We are now in year 3 of that work. Our organization was a key partner in shaping the community engagement process. It engaged over 350 Black women, men, childbearing age youth, and health workers into the discussion about mapping a course to improve these outcomes over time. And we are 3 years into that process and currently going together with the United Way and the health systems to secure dollars to build a coordinated care system in our county that will build and connect the massive number of social support resources we have and integrate them into the electronic medical records of patients in our county to address those social determinant needs around housing, income. And I'm gonna show you a couple slides as to why this is so significant. When we did this outreach to inform this 5-year strategic plan around improving birth outcomes, and we talked with those 350 Black women in our community, this is what they told us are the root causes that are impacting their health. Stressed Black family systems, generational struggle for economic stability, institutional racism and bias and its looming impact on Black life and progress. And we know that the solutions have to be broad. These are 10 of the critical and consistent themes that came out in that study, and you can skim them. This report, Saving Our Babies report, is available on our website at FFBWW.org. I want you to read it from front to back because it's beyond birth outcomes. It is really naming the root causes of the inequities and the disparities that we are talking so deeply about right now in our community. And this will clarify for you, your organizations, your community, your networks, how we name the root cause and how we begin to build a new narrative of opportunity and prosperity and thriving for all segments of our community. So I'm going to ask you to do that for me and to spend time on this slide. Spend time on this slide that really tells us the key factors that drive health outcomes. A small percent is people's personal health behavior. The bigger percent is economic and social context, economic security, social connectedness, and the availability of quality care. So really look at that and internalize and take the focus. We have to all take the focus off of individual community, individual person, to systems level thinking and realities of what we need to do to impact the ecosystem that is impacting Black women and Black family health in our community. And that is where we will begin to make traction that sticks, especially now as we are grappling with how we truly achieve racial equality and equity in our community and our country. We have achieved great things over the last several years. We've gained national recognition for our work, and we're so proud of that because we're putting Wisconsin on the map for solutions. And that is so critical, and we're determined to drive solutions, not just talk about the challenges. And we ask you to join us in that. We opened Dane County's first Black Women's Wellness Center this past January. You can see our county exec was there, our mayor was there, many folks were there to celebrate with us. We opened, and immediately to huge response from our community as a demonstration center for all the ways that we can invest and pour into Black women and empower them to improve their health while also engaging our partners. Unfortunately, we did have to close in March because of COVID, but we've launched virtual education and we're continuing all of the things that I shared with you earlier, and it's opened up a new venue to have reach even beyond Dane County. So how do we disrupt these disparities? And I am coming to a close. I just can't see the screen that far away. But our focus has to be empowering and supporting Black women to improve their health now through education, support, positioning Black women as leaders and key informants of the solutions that we create. We have to be driving the solutions, not simply receiving the solutions. Connecting Black women to our health systems, to cross-sector partners, across economic development, across housing, across education, to co-create strategies and solutions together that ultimately improve Black women's health, and to shape shared priorities as a community, aligning our efforts, our intentionality, and our focus to generate and drive powerful change in Dane County and across Wisconsin for Black women's health. That is our mission. That is our vision. We believe we can do it. We want to acknowledge several funders and partners we have. We don't do this work alone. It takes lots of support. This is just some of the support. I didn't have time to update this slide, but I want to give deference to the organizations that have believed in us, invested in us, because we are making traction because of that belief and that investment. And we ask you today to join us in these efforts, because now is the time. The work cannot wait. The lives can't wait. I talked to you about the alarming outcomes, and we're working every day to save lives now, while also working every day to save lives into the future and to move Wisconsin from worst to best for Black women's health. And we ask you to join us in that journey. Thank you so much. Thank you for the opportunity to be here today, and blessings to all of you.
Thank you, Lisa. And we have some questions for you if you can spare. I think we have about 3 minutes left. We have 10? Okay, good. So, and the first question is, what is the life disparity between Black and white women in Dane County? And that's from Maria Alvarez-Stroud.
Yes, we have asked Public Health Madison for that absolute definite statistic. And right now, the numbers that they are reporting to us is that average age of death. What we know right now for our state is that life expectancy for Black women is around 65, and for white women, it's around 83. And so there's a significant distance there. It depends on what year, what study you look at. I've seen another that has said 72 for Black women, still 83. So there's at least a 10-year gap in life expectancy based on the data source that you look at.
Neil's question is, how far back does this disparity in lifespans go, and to what do you trace the causes of this gap? How far back does this gap go?
So for Dane County, I can say that when we asked Public Health Madison Dane County to pull the data around life expectancy and average age of death, this went back 20 years. So over the 20-year period where we've looked at average age of death here in Dane County for Black women, it has only risen by 1%. It was 59. It held at 59 for many years, and in 2017, it had risen to 60. So it's been a slow and unacceptable rise. To look at state data, I'd have to get back to you, but these inequities have been persistent at least for the last 25 years, that our systems have been disaggregating data by race, by gender, and you will consistently see those same gaps persistent and unmitigated over time. One thing I'll say about that is, one thing that folks don't realize about Wisconsin is we used to be a leader in the nation for Black family stability, and one of the top states in the country for the growing Black middle class. Part of that was the booming industrial economy of Milwaukee. And so if you look back at data in the late 60s, 70s, you would have seen better outcomes around economics and family stability and security. You would have seen Black men working at nearly equal rates as white men. That has changed dramatically. Milwaukee has transformed from a best place for Black families to a worse place for Black families. Economic security is at the base of that, and that is impacting Black women, Black men, Black children. So we need to look at those lessons for insights on how we turn this tide statewide.
Okay, great. Next question. Are there efforts at the medical training / educational level, be it physicians, physician assistants, nurses, first responders, to recognize the disparities in medical care for women of color?
There's a lot of conversation about that now. There's a lot of research being devoted to that one piece, and I'll say one piece because I continue to veer our attention to systemic, economic, social, other pieces of the pie that we know exert equal control. But yes, there is a growing, burgeoning effort to look at the training and preparation of medical providers, practitioners, nurses from frontline all the way up to the top surgeons and the folks who engage with Black women, because there's consistent research that bias in delivery, bias of perception, bias of treatment courses, bias of treatment of pain, believing patients is a real factor. And I know locally our 4 health systems here in Dane County are doing diligent work to increase training, and our university partners are doing much in the preparation of doctors at our School of Medicine and Public Health to address equity issues.
Thank you. We often ask, how can we help? But sometimes the actions we think are helpful may be unproductive at best and harmful at worst. What are a few examples of ways that people think they're helping, but actually are not?
That would take several hours and a whole discussion with that. You know, I think in most cases, people are well-intentioned in their desire to help, but the key in ensuring that the help is meaningful, that it's relevant, that it's responsive, goes back to something that I said in my talk, and that is going directly to the most impacted populations of people, going to Black women, going to Black communities, and asking them, what solutions do you need? What capacity can we support you in building within yourself and your own community to build the infrastructure that's needed to build community and family capacity? How we approach funding decisions needs to be informed by that. How we approach our giving decisions needs to be informed by the data, by the most impacted, and really building the capacity of those folks in those communities to create and co-create the work. And then we know we get the solutions closer to right, if not right, every time. And it still will be complex because these are complex issues. But doing that first puts us ahead.
This next question from Mike McKay. How about using the budget from school resource officers to establish more integrated healthcare centers in our public schools for wellness / primary and behavioral health care?
I think that's an excellent idea. I think that it would be a cell that would take incredible community support and advocacy amongst folks like you and the Rotary who have positions of influence to really inform such an innovative idea, because part of solving the health disparities we seek is starting early and building measures into our pipelines and our institutions where folks live and exist and carry out so much of their lives on a day-to-day basis. It's a novel idea, and I think in this new ambiguous time of change, undefined change that world events and coronavirus has ushered in, it's the time to put those innovative ideas and thoughts on the table and to consider them seriously.
Great, thank you. Who or what organization represents the cost of healthcare for women of color in Washington and local state houses? Is there a foundation that is devoted to those causes?
In Washington, D.C.?
Well, Washington is the state house. These are a national foundation. If you think about the Bill Gates Foundation, what they're doing, right? Yeah. There's national foundations. Is there one across the nation that is influential in Washington and then key in some state houses?
I would say, so there's a National Black Women's Health Advocacy Organization that we communicate with often. That's the Black Women's Health Imperative. They were established in 1975, and actually we had them as our keynote speakers 2 years ago at Black Women's Wellness Day. They are closely watching our work here in Wisconsin, and I would say they're the flagship advocacy organization. Among foundations that are grappling with health disparities, I'd have to say Robert Wood Johnson Foundation obviously is a huge funder of healthcare solutions, health equity solutions, and there's others, many, Ford Foundation, Kresge, There's many that are doing pieces and parts. The Schmidt Futures Foundation that we're pitching to right now with the Dane County Health Council to bring $1 million into our county to support this care coordinated system that I mentioned. They're a California-based organization that is really looking to drive not only health equity, but more to raise the income of 10,000 families by 10%. These are all collective efforts to address this issue.
Okay. Final question is, what is one action that each person in this virtual room could do to make an impact?
Call us up to have a conversation, to talk about the issue and to understand it on a personal level. Become a champion of this issue and bring it to the center of your conversations and your spheres of influence. Influence and direct people to support efforts like ours at the Foundation for Black Women's Wellness and other community organizations here who are specifically focused on driving health, social, and economic equity. And of course, give. Giving never hurts. It's always well received. With that, I thank you. I love the questions. And again, I appreciate this time with you. I thank you for this stage. And I ask you to really be champions of Black women's health with us. We thank you in advance and we honor you for all that you each do every day to build a stronger, thriving Greater Madison. Thank you.
So now do we run some applause on there? Oh. Okay. So thank you for the presentation. Lisa is outstanding. And one thing that you don't get, Lisa, the appreciation of the impact that you're making on people here. And I think you'll notice in the chat, unbelievable amount of positive comments. So you can always go back and look at it. But really, people, you have touched a lot of people here, and you can see their names and so forth. So I'm sure there'll be follow-up on it. But thank you for an outstanding presentation. And thanks for everyone who attended the meeting. And I guess I should, go ahead and take it off. With that, thank you so much for listening in. And it's great to see all of you. And we are adjourned.